Sir, please start.
Respected senior dear friends, welcome back to today's sessions on Vaccine Samvad. The topic is very unique, that is an adult vaccination chosen by none other than our own Dr. Nitin Shah sir. So we'll be keeping our preliminary very short today. Accordingly, I request our President Dr. Sanjay Pakmoda sir to address the meeting. Sanjay sir.
Namaskar. Welcome to the MahaIP platform. Now today, almost eighth episode of Vaccine Samvad. Ninth episode of Vaccine Samvad, and today's program is really unique because it is panelist. Our moderator, Dr. Nitin Shah sir, is always there, but our panelists for today's program means they are very stalwarts in the vaccines. Dr. Raju Shah sir, Dr. Srinivas Kasi sir, and our young Pankaj. Pankaj is lucky enough to join today's session because he gets such an opportunity with the Kasi sir, with the Raju Shah sir, with the Nitin Shah sir. It comes once in the lifetime. So great. Means on the MahaIP part, I wish you are blessed. So today's topic is adult vaccination, a very important topic, rather very forgotten topic also. Because in our mind, it has been rooted. The vaccination is only up to 5 years. The same thing like if the pediatricians, they are supposed to see the children of 8 to 10 years. After 10 years, you ask somebody will say, no, I have to go to the physician because I can't sit with the people who are very small over there. So this is like this. The same time, the vaccination, the same thing is applied. Even you ask any intellectual people also, intellectual family also, they'll also say, okay, we have to take a vaccines. Thank God to that cervical cancer vaccine, which has again developed some interest in the adult vaccination, and people started realizing we need adult vaccinations. Now, why adult vaccination? Because it has been said whatever vaccines given in the infancy and the childhood period, the immunity wins over a period of time. So we need to put some booster doses so that vaccine may long for further more years of life. The very true about that DPT vaccine, which we give TDAP at the age of 5, 10, and then 16. Then the second one is, as the immunity wins, so we need revaccination. The same time, there can be a catch-up vaccination also. People who have not taken vaccine at all, then they ask the question, if right now we are eligible for the vaccination? Yes. So they can be given few of the vaccines at that proper particular age, which our experts will tell you today. Then the travelers, when we travel outside, then we need some vaccines. And means these are the reasons for the adult vaccinations. So let us understand from our experts today, see what adult vaccines can be given, and rather this might initiate one more thing in the IAP. If we should put a board of adolescent vaccination in our OPDs or outside our OPDs, the adult vaccination is done over here. And about the cervical cancer vaccine, that has to be taken at that age only, not earlier, after 9. So these are the reasons for which we need adult vaccinations. So over to Minhas sir, because we don't want to spend more time, because we want to hear from the experts only first. And with it, we must welcome our today's moderator, Dr. Nitin Shah sir, and panelist Dr. Srinivas Kasi sir, Raju Shah sir, and Pankaj Agrawal, our secretary Amol, and scientific convener Minhas sir, and other office bearers of MahaIP, CIP, and all the attendees. Thank you. Once again, welcome to MahaIP.
Thank you, Sanjay sir. So I will just take 1 minute. So thank you, Nitin Shah sir, for everything. These 9 months, already more than 10,000 viewership we might have got on YouTube, or more than that also 15,000. So I welcome mentors, Dr. Raju Shah sir, past president in Indian Academy of Pediatrics, Dr. Srinivas Kasi sir, the Dean of Vaccination, the Dean of Vaccinology in India, along with Dr. Nitin Shah sir, and also our young gun, Dr. Pankaj Agrawal. So for this session, very innovative session, we know that adult vaccination, even if we are pediatrician, people for various reasons, for various conditions, transplants and all these things, they will come to us for vaccination and they will ask first whether these vaccines are available with us or no. We know that adult physicians, their physicians are very much busy in managing the cardiac cases and all the general illnesses of adults. So it comes to us only about vaccination. So I once again welcome all the experts, moderator Dr. Nitin Shah sir, and all the attendees, all the election candidates and all the PG students as well. And also I will take this opportunity uh, to request all the Maharashtra IP people and those who have joined this webinar to vote our presidential candidate, Dr. Samir Dalwai sir, and also the deserving candidates of OBs and EBs from Maharashtra, and the voting will start on 22nd of October till 29th of October. This time they have a change schedule because of festival season. So from 22nd it will start, and I appeal all the Maharashtra IPNs to vote for the right candidates and vote for Dr. Samir Dalwai. Thank you. Over to you, Minas sir.
Thank you, Dr. Amol Pawar. Now over to Nitin Shah sir. I will not introduce because I believe during the course of preliminary introductions been done. So come to business. So for the business dealing, Nitin Shah sir. Over to you, sir.
Thank you, Minaz. Thank you, Dr. Paknode, Amol, all others who are present here. First of all, a disclaimer, today's meeting is starting after the election Achar Samhita has started. So we will not like to take anyone's name or appeal to anyone to vote for anyone because that is not correct. Number two, all the potential candidates who have joined here, they have joined as delegates because we don't have a separate Zoom for delegates and faculty. So though they are in the same link, but they are all delegates. And these delegates, those who are potential candidates will ask question at the end as delegate, but will not interfere with the science when the science is being discussed. This is in your interest. I am very happy to be moderating the 9th month of Vaccine Samvad. It's like the baby now is getting delivered. So another 2 months, the child will become 1 year old, and I hope the child continues to grow in the second and the third and the fourth year by the incoming president. Of course, someone else will take over the moderatorship from me, and there'll be many more members who will be faculty. I'm very happy today because number one, adult vaccination is an important thing, as everyone has been saying. Not only because it will increase your practice when you give adults the vaccination, but also because we are adults and many of us are about 60, 65, 70. Some of us can be having some at-risk condition, and I think it's important for us to take vaccine ourselves so that we can then protect also our family members, our spouses, our parents, grandparents, and help the community so that to avoid any vaccine preventable death or any vaccine preventable serious illness. So with that, I'm very happy that I have in the panel Dr. Raju Shah, who is like, he was the president just before me. We are like brothers. I remember I got interested in the vaccine field when I read is the blue book. People don't know, you all have purple book now, but the original vaccine book was a blue book.
Yes.
Which was when Dr. Raju Shah was one of the members, or maybe he was the convener, I'm not sure. But they brought out the first book in a book form, blue book, and I still remember that blue book.
Yes, I had that book,
yes, Dr. Resha? You said something, Raju bhai? No, okay.
with me.
Then we have Dr. Kasi. He's like my guru and my vaccine co-guru, I would say. We are doing a lot of projects together. One of them being a very interesting PG teaching session that you will see in the next year. And then, of course, last but not the least, we have always heard Pankaj conducting this meeting, but today the change of role, and he joined us as the panelist. So I would request Dr. Kasi, Dr. Pankaj, and Dr. Raju to keep your mics and videos always open. And maybe we can have a focus now on three of us, Dr. Pallavi Madam. So let me start So let me start with the most young person faculty, Dr. Pankaj Agarwal. Dr. Paknode did mention about adult vaccination and need. Can you briefly say why adults need vaccines? Why it's not only a pediatrician who give pediatric vaccines? Unmute yourself.
Pankaj, unmute.
Keep yourself unmute, please. You are not able to unmute? Okay.
Yes. Thank you, sir. Thank you for the opportunity. So I'm honored to join this esteemed panel today. So why do adults need vaccine? The basic question is, so the immune protection induced by vaccines during infancy wanes off over the period of years. So it is important that we vaccinate them and give the booster to the waning immune response for certain vaccines like measles, pertussis, tetanus, diphtheria. It is also important to protect the adults against the diseases that has high prevalence and high morbidity in the adulthood, like hepatitis A or varicella vaccine. Then certain adulthood diseases like HPV for the cervical cancer vaccine, anogenital cancers, and other cancers, it can prevent those cancers. So HPV vaccine is important adulthood diseases. As a public health program, certain vaccines are introduced like COVID-19 or rubella, congenital rubella control program. So these vaccines are important for adults. Then international travelers or students who are going abroad for study, they need vaccination for prevention of diseases endemic in those regions. Then in adults, usually most of them they might suffer from certain chronic diseases. So vaccines are required to protect them from the chronic diseases or immunocompromised states. So, some might be having chemotherapy or cancer chemotherapy. So those adults are in the especially high risk categories, they need vaccination. And few of them might have missed the vaccine in the infancy. So they may need the catch-up vaccination schedule. So
Perfect.
adult vaccination is an important part.
I think very nicely summarized as to what are the scenarios where adults would need vaccine. And I think one of the most important is immunosenescence. As
Yes.
we grow old in all the body parts and also the immune system. So while the young is immuno-naive, the elderly are immunosenescent and they have lost immunity to previous diseases or previous vaccine, and at the same time they are at risk for developing certain dreaded disease, and that's why adult needs vaccine. So after the lifestyle diseases as the number one cause of mortality, the next is the vaccine preventable disease, especially like pneumococcal and so on and so forth. So Pankaj, can pediatricians give adult vaccines,
Yes,
or is there that they are now MD so they cannot give adults? This is a
uh,
question which is from many times
yes,
comes in the mind of people. They get a little scared while giving.
okay. So basically, all the pediatricians they know the science behind the vaccinology and immunology
Okay,
much more
okay.
better. And
Mm-hmm.
because they are the people who are proactive in giving vaccination in the infancy and adulthood, in the adolescent age, so there can be a connect with the parents, and we can increase the opportunity to give vaccine to the adults, and they are entitled to give vaccines to the adults. But before giving vaccine to adults, they must consider the guidelines given by the Association of Physicians or
But there are
the
several guidelines. There's no
NCI.
one guideline. I mean, when I was
Yes,
part of the Influenza Foundation of India, we had 13 different professional bodies of adult,
yes,
cardiac, geriatric, chest physician,
yes,
CSSD, and I mean, you name it, API, of course. So,
yes,
there's no one consensus as far as adults are concerned. I think we have to use common sense and common knowledge. Maybe
common
go to
knowledge.
an
Yes,
international guideline, WHO, CDC, etc., rather than just to try to stick to. Because some will say pneumococcal only polysaccharide, some will say pneumococcal from 50, some will say pneumococcal only for 65 and above, and so on and so forth. So take the guidelines from international arena also when you actually vaccinate. Now, the third question before I jump to the other panelists is that if suppose pediatrician wants to give vaccine, I mean, as pediatrician, when we give vaccine to children, we are prepared for any untoward reaction that should happen. We counsel them, etc., and we are like trained to manage a side effect, like say anaphylaxis. What about when you give to adults? What are your medical legal requirement and any liability?
yes, sir. Sir, before vaccinating the adults, we must ensure that we have all the medical care equipments at our hand side. We should have an
Like
adult ambu bag,
like
laryngoscope. We should
one
have an
adult
adult
laryngoscope or a
laryngoscope. We should
laryngoscope
have
with
an
adult
adult
blade.
ambu.
Okay, number one. Number
We should have
two,
an adult ambu bag. We should have
ambu
an
bag. Okay,
yes, adrenaline and other emergency drugs if needed.
which you anyway you will have for pediatric. For adults, adult laryngoscopic blade, ambu bag, and third,
Ambu bag,
adult endotracheal tube.
endotracheal tube. Yes, we
These
should
are the
have
and
that handy because
yeah,
there can be some kind of reaction, so we should have them at our
yeah.
clinic before giving
And some
vaccination to
resuscitation
adults.
program you should have
Resuscitation.
undergone in
Yes.
some your hospital or wherever. So you know how to handle an adult when it comes to some serious, because it may so happen the adult may actually collapse of myocardial, some stroke, not related to vaccine, because he's as such in that age group. But the whole blame will go to vaccine if you're not prepared with your preparedness to control. I mean, to look after a AEFI.
And again,
If
sir,
you
before
have
starting the
clinic,
vaccination,
Yes, Raju bhai.
yeah, if it is only clinic, then you should also have the proper oxygenation facilities even for the adults and
Yes,
fluid thing, because in
correct.
clinics you don't keep that, so you have to be keeping those provisions also.
So, like in the hospital, we have the crash card. It's not possible in small clinic, but what you should do is just below the examination table where you're giving vaccine, the first drawer should be empty only for resuscitation. So, ambu bag, laryngoscope, adrenaline, efcorlin, IV fluid, IV set, IV bottle, your venflone, and your other material. And if you don't have a large oxygen cylinder, you have now portable cylinders which can go on for half an hour to 1 hour. That's enough to tide over the crisis. So people can invest into all this and be prepared. No, because this is also pediatrics, not adult. That I mean, I've had anaphylaxis in my clinic 3 times in last 40 years of practice. So when I don't have a side effect of vaccine for many years, I get very worried that next day is going to be the bad day for me. So you should be prepared for any such eventuality.
And
All right.
one more point.
Yes, Dr. Kasi.
Like we do a pre-vaccination checklist for children, we
Correct.
have to be look into all the comorbid condition of the adult.
Yes.
Look for drug allergies, previous vaccine reactions. Like we do for a child, you should do for
Correct.
an adult as well.
Correct. What I do in my practice, that when I don't have an adult vaccination card to promote, but because most of the patients ask and they now know, they ask about the vaccination, whether I'll do it. I also tell them, if you have any serious comorbidity, please get yourself checked by a physician that you are fit to take this vaccine. So that itself means that you have taken due precaution. Let's move to Dr. Kasi. First vaccine, pneumococcal, I think very important. Why pneumococcal vaccine in adults?
If you look at the incidence of pneumococcal disease, it's sort of a reversed bell-shaped curve.
Correct.
Very high incidence in the first 2 to 5 years, very low incidence between 5 and 49 to 50 years, and then upstroke, and a very deep upstroke above 65 years.
Absolutely.
So that's the pattern. In fact, studies have shown very high incidence, almost about 17 to 20 per 100,000 in those above 65. Those who have comorbid condition, it goes as high as 60, 65. And those who have immunosuppression, it's almost as 100 per 100,000.
Correct.
See,
And if you have two comorbidities together, it jumps
it goes,
4 times.
yes.
And the worst two are the sickle cell anemia,
And
asthenia, and HIV patient who are not
yes.
well controlled on ART.
Yes.
They can be as high as 400 to 500 to 100,000.
Right. So basically, we have a very high burden. It's not only the medical, it also
Correct.
causes a lot of societal burden.
Yes.
Healthcare costs, healthcare utilization, loss of pay, especially for the little younger adults.
Correct.
I think for all these reasons, adults also need pneumococcal vaccination.
And that is very interesting. Sorry, go ahead. Yeah, sorry.
No. I mean, all adults above 50 and those between 18 to 49 with comorbid conditions should be vaccinated with the pneumococcal vaccines.
So it's very funny that influenza and pneumococcal disease may not be the direct cause of mortality, but once they have had inside the hospital for one of this, the chance of dying because of associated like myocardial infarct, stroke in the next 90 days is very high. So it's not only for direct prevention of the disease, but also overall mortality. One question that came in one of the Gujarat pediatrician group is that one person asked that why not only give PPSV23? It's so cheap, 2,500. Now you have PCV20, which is so expensive. So what is the role of PPSV23? Drawback and advantage, if at all?
Now, PPSV20's only advantage is the broader serocoverage.
Correct.
But in all other respect, it's inferior to a conjugate vaccine.
Correct.
It's T-cell independent, IgM antibody, low avidity, low affinity, no germinal center, no memory cells, no reduction of nasopharyngeal carriage. You cannot use it below the age of 2 years, where there is most need for the vaccine.
Correct. No herd effect.
And no herd effect, no nasopharyngeal carriage and herd effect both.
If at all hyporesponsive, if you keep on giving it every 5 years, you
yes.
can't give more than 2 times in your lifetime.
And all these disadvantages have been overcome by conjugating it with proteins.
Correct. So now let's come to the PCV, which are available for use for adults in our country as well as in general abroad. So 13, 15, and 20 valent. Advantage, disadvantage of each over one another.
Now, we have a lot of data coming from USA. We hardly have any data from India.
Correct.
So when they looked at the coverage in adults, PCV13 today covers only around 38% of adult IPDs.
Today, after 25 years of
Years
use of
of use.
PCV in
So
USA.
only 38% is, that means in spite of PCV13, failures where certain serotypes are not covered, 38%.
Correct.
When you come to PCV15, it's around 42%.
Correct.
When you come to PCV20, it comes to around
Yes.
52%.
Correct.
And you come to PCV21, it jumps up to 85%.
Correct.
So basically, PCV21 is a adult specific vaccine. Of course, we can't talk about it because it's not available in our country.
Yes.
So now what are we going to gain additionally by changing from PCV13 to these higher valencies?
Correct.
If you use PCV15, you get about 10% better coverage. If you use PCV20, you get around 32%. If you use PCV21, you have almost 45% higher coverage.
But
So
my question, Dr. Kasi, at this point is that this
Yes.
is all after 25 years of use of PCV, where the vaccines would have
Exactly.
disappeared.
Yes.
But in a country in India where we are using 10 variant
No.
or 14 variant, and it's still not
No.
like that
So
high a coverage. 13 also may still lead to good coverage in our country.
definitely in our
Yes.
country, 13 will definitely lead to go. It's like what US was maybe 15
Correct.
years back. That is
Absolutely.
the type of coverage we are having. But we
Correct.
must remember that we are having high coverage of close to 83 to 87% PCV13.
Correct. Since
And
last
that
2-3 years
coverage
at
is
least.
high enough to induce herd immunity. So there's going
Correct.
to be a change in seroepidemiology,
Correct.
even in adults as well.
One question: the 20-valent vaccine that MSD made is almost 14 serotype different than the 15
Yes.
or the, so it was made basically for the
For
remaining
adults.
disease burden. So
Yes.
in India, it may still not have that advantage of very high
Yes.
coverage vis-a-vis 20, but it is a vaccine for future because, as you say, all countries behave the same way when it comes to vaccination. So of course, 21 valent is not available, but is available is PCV 20. So what would
Right.
be your recommendation of use of PCV in adult today?
Okay. Now, if an adult has not received any vaccine, I think the
Correct.
choice would be to go for PCV. I won't talk about PCV21 because it's not available in our
No,
country.
correct.
Let's talk
Correct.
only about PCV20.
Even 15 is not available. So let's talk
15 is
about
also.
13
So
or
we'll
20.
talk about
Yeah.
only 20.
20, correct.
Now, if a person has received PCV13, then he can receive one dose of PCV20.
Correct. At
It should
least
be
a
at
year
least
after.
1 year after
Yeah,
that.
all right.
If he has received only one dose of PPSV23,
Mhm.
then after 1 year he can take PCV20.
Correct.
If he has received PCV13 and PPSV23, and the PPSV23 has been given before 65 years,
Correct.
in that case, you will give PCV20 at least 5 years after the last PCV dose.
Correct.
So these in brief, short
I
is
see.
a recommendation. But if someone above 65 years has taken PCV13 and PPSV23, and if the PPSV23 has been given after 65 years, then there is no need for any additional vaccines, though on a one-to-one basis you can discuss and
Yes.
give PCV20 5 years after the last. So that
Correct.
in short is
And
a CDC recommendation.
correct. And for those who have taken PCV 20, there is no need to then take
Eh,
PPSV 23. That's the advantage.
Exactly.
Because
Yes.
that was the consideration, a discussion where I actually put in reply that either PPSV 23 may cost say 2,500,
Yes.
PCV 20 say 5,500.
Yes.
But if you say you have to go PCV 13 followed by two PPSV 23, the
It comes to
cumulative
the
cost
same.
is more than one PCV
Yes.
20. And of
Certainly.
course, you are giving a vaccine which is very powerful because no matter what you say, when you give PPSV 23, there's so much of cytokine storm and unnecessary antigen release in a
That's
senescent
right.
body that actually dampens the immune
Immune
response
response.
to the subsequent. That's why the schedule also has to be first PCV and then PPSV and
Correct.
not other way. I
Right.
would strongly say that I don't think so. Any of us cannot afford PCV 20, so we should only take one dose of PCV 20 if you're above 50 and thereafter. And so, as Dr. Kasi said, you've taken a PCV 13, then to give after 1 year. If you're above 65, you can take it that time. And if you have taken a PPSV 20 also, then you wait for 5 years. Am I correct, Dr. Kasi?
Yes.
Perfect. All right. So need for booster, I'm very intrigued. Like you need 3+1 in children who have such robust immunity, and adults who are senescent now. They're like, how one dose is enough? I mean, I know there is no country is giving a booster, but
I
somewhere
know.
like you are taken, say, you take it 50 years, and you are now 75 years. You take 25 years, it will last the.
I know this is a very intriguing question for which there is really no scientific answer, I think. But
Correct.
basically, there is no recommendation for a booster of PCV in
Correct.
adults.
What about immune compromised adults?
No recommendation
So
even now.
except for transplant, where
Yes.
they actually are given like a child 3 doses,
Yes.
0, 1, and then 6
That is
months.
basically revaccination, not a booster.
Revaccination. Otherwise, even in an
No.
immunocompromised but
No.
non-transplant patient, you still depend on recall memory.
Correct.
And several vaccines have shown that there is a beautiful recall
And
memory.
yeah,
even
we
at-
must remember that even with immunosenescence, it is the naive B cells which are affected, but the
Correct.
committed B cells are maintained. They can respond very well to subsequent exposure, but new antigens, they will not elicit a good enough
Correct.
response.
So the memory cells remain till you die.
Right.
And that's the I mean, that's the way human body is made, that you don't die of a disease that easily.
Right.
All right, let's move to the next vaccine, Zoster vaccine. Very important. Dr. Rajusha, why Zoster vaccine to adult first?
Yeah, we all know that the herpes, the disease that occurs in the adults, as the age advances, the disease becomes very severe.
Correct.
Not only disease, after a disease is cured, you get the neurological pain or post-herpetic neuralgia, which is worse, and it lasts for months or years.
Correct.
So that's a worse situation, and anybody whose relative or somebody in the near about known person has suffered from herpes would know that how bad the disease is.
Absolutely, I agree. I mean, it can lead to even suicidal tendencies in some very elderly who are aloof at home and nothing else, and keep on having sleepless night because of pains and itching. Go ahead, sir.
So increasing with the age, the severity also increases. So
Yes.
if after age 50, 45, 50, if somebody gets, or after 65, somebody gets, this disease is very severe after 65. So that is why it is very much needed. And there are complications also, like ocular complication, neurological issues, and secondary infection also. So to prevent complication, to prevent the post-herpetic neuralgia and prevent that increased risk, I think all the adults above 50 should receive the this vaccine.
So while 15% of zoster happens in pediatric age group, essentially because they either develop varicella in utero, in a mother who didn't have varicella in the past, and the child is born without knowledge they had varicella, a very short-lasting immunity and develop zoster very early, or children who are immunocompromised, like my leukemic patient of chemotherapy. Yesterday I had a patient of Hodgkin disease, just given 3 cycles, and she came today with herpes zoster. She's just 14 years. So that can happen, but generally children are spared. Above 50, it starts raising hand. After 60, 65, the incidence very drastically goes up, and after 75 is almost a rule. So I mean, what percentage of adults would develop at least one zoster in lifetime if they have not taken vaccine?
8 to 10%.
I think the around 4 to 5 per million population is what I have read.
So it's almost like 50 to 25% till 50 to 65, and after that it jumps to almost 1 in 3 or 1 in 4 by the age of 75. Correct, Dr. Kasi?
Yeah. Almost a third above 65.
Yes, right. Now, why live zoster vaccine is no more available or used in the world is like fading away, Dr. Rajubhai.
Yeah.
The Zostavax from MSD. Some of us might have taken it in the past.
You know, primarily it was a little weaker varicella virus itself in the vaccine. And the immune response itself was very poor, or almost say 40 to 50% or so. And the immunity was not lasting that long.
Short-lived.
A short effect. So when superior alternative came market, it was a short-lived, and that is why that vaccine has been more or less withdrawn. And
it could not be given in immunocompromised host being a live vaccine.
There was no effect in the immunocompromised.
Because they are the ones who needed more. Of course, everyone needs, but more in those who are immunocompromised.
Yeah.
All right. So let's talk, Dr. Rajubhai, of the vaccine available. Shingrix. We'll take the name because it's easy for people to relate to which vaccine we're talking. We are not promoting any brands. Shingrix from GSK is recently made available, I think more than now 2 years. So what about this Shingrix? How good it is as compared to Zostavax, as you said?
The Shingrix is a non-live recombinant vaccine.
Correct.
With excellent adjunctive into it. So it is AS04, which is considered to be the best, and AS104.
AS01, yeah.
AS01E.
So that's be a one of the best booster
Correct.
available agent in the vaccines. And so with that, the efficacy is much higher.
Like
almost to
what
the
is the
tune of-
long, short-term
the
and
long-
long-term efficacy? Yeah.
Yeah, short-term efficacy is almost as high as 70% or so.
Even
70 to 90% in some of the
90%. Okay.
studies.
Long-term,
And a long term is more than 5 years is almost, it remains for 60 to 70% of the population.
Right.
And there are studies which have shown that even it lasts for 10 years also.
correct.
So
And
with the
beautifully,
vaccine
even the efficacy is the same even in elderly 70, 75 years as it's in
Yeah.
the younger age group. So that's a beautiful advantage.
Yeah,
All right.
even
So
at
now, who should,
even at-
Dr. Kasi, yes,
now,
sorry.
even at the end of 10 years follow-up, the protective efficacy is about
80%.
73%.
That's
73%, which is great. Yes.
Okay, so Dr. Rajubai, who should take it and what is the schedule?
I mean, every person should take about 50
So at
years.
what
of
age can you start? 50 years, okay.
And you can take at any age. There is no higher age limit, but up
Correct.
to 70 can take.
Correct.
You have to
Schedule?
take schedule is 2 doses.
Mhm.
1 dose and second dose between after about 2 to 4 months or 5 months. So
Correct.
before 6 months you take the second dose can work as a booster dose, though it can be given after 1 month also. So
Correct.
2 dose schedule should be followed up in this vaccine.
So once I had invited Dr. Kasi to talk at the vaccine CMA, I had kept the title pain of the vaccine or pain of the disease.
Yes.
It's a very painful. So safety part, Dr. Rajusha, how painful it is.
It is very safe. There is no issue
Yes.
with the,
No
safety.
serious side
There
effect.
is,
Yes.
some local side effects, mild pain, little tenderness over the area, and little bit of generalized feeling that you
Malaise,
have
yeah.
malaise.
So I always say that
There
people
are no
should.
severe side effects of pain.
Correct. So I always say that take it on a Friday or a Saturday because you have at least 1 or 2 days to rest.
Yeah.
That is especially for busy practitioners.
Now,
All right.
Nitin, 1 minute.
Yes,
Now,
Dr. Kasi.
regarding the adverse effects, I think let us
Yes.
be a little more clear about it.
Okay.
It is definitely a more reactogenic vaccine compared to many of the other vaccines that we're using, and that is because of the adjuvant that is
Adjuvant,
being
correct.
used, which
Correct.
induce a very strong
Immune
both
response.
innate immune response.
Correct.
Generally, the adverse effects is more with the second dose compared to the first dose.
Correct.
Now, I have had occasions where I have given Shingrix to some of my, parents or grandparents, and after the first dose, they've asked me, is it okay if I take only 1 dose? Now, we must remember 1 dose gives only about 66%
Yeah.
protection. Second
And
dose
we
is
don't know how
definitely-
long. And you don't know how long.
So,
Correct.
2 doses are really necessary.
Right. I mean, you can liberally use antipyretic after the vaccine
Yes.
and eye supply. And if you prime them, then they are ready for it.
Yes.
Unlike with other vaccines. All right.
Right.
Yeah, we have to tell them that probably there will be a pain after this vaccine. So you should
Yes.
Correct.
Exactly.
give paracetamol or other analgesic for at least 48 hours or so. So that
Correct. Dr. Rajusha, in our country, yeah,
What is also
we are losing
virus
your voice.
also the quantity of virus is also high in these.
Correct. Correct.
So that is another reason why you get a higher reaction.
Okay, Dr. Rajubhai, now in our country it's not licensed below 50 for immunocompromised, but world over it is licensed for
Yes.
immunocompromised from even in below 50 years. So some light on the immunocompromised and lower
Yeah.
age.
No, definitely it is recommended all over world.
19
in
to
the all
49.
immunocompromised, yes, 19 after 18 years. So 19 to 45, 49 years of age, any immunocompromised child or adult can take this vaccine. And again, in a immunocompromised host, it is usually given after 1 month of a first dose. The second dose is given immediately, not waiting for a longer time.
Okay. Kasi wants to add something?
No,
We
that's
have
it.
studies in CRF patients, we have studied
Yes.
in transplant patients, we have studied in HIV patients. Some of them are efficacy, most of them are immunogenicity and
Immunogenicity.
safety, and they are all excellent. I think this is one vaccine which everyone who is immunocompromised should take. So I would even use it as off-label because it's already recommended world over. So maybe taken a written consent for if you're using an immunocompromised host.
Right.
All right. If someone has received Zoster vaccine past, Dr. Ajibhai, then how do you go about with this vaccine? When do you give it, if at all, and how many doses?
Yeah, I mean, this vaccine needs to be given in 2 doses only. And
Correct.
we after about 5 years of given the Zoster vaccine.
Yeah. Okay. So maybe you can give an as early as 1 year after the last dose of this Zostavex if you need like in a very elderly person or an immunocompromised. Of course, immunocompromised would have not taken the past Zostavex, but that's the way. So I think this is a very important vaccine, though it's expensive. But as Dr. Rajesh has said, I mean, I've also had
Definitely about
relatives
that.
who had post-herpetic neuralgia. It is a tremendous irritating illness. It doesn't kill you, but it
Right.
doesn't allow you to sleep also. And you know, you're constant. And then many of them are on GABA, Pantene, and they are on anti-itching medicine, sedatives, application, and all. It's a hell. So please take this vaccine if you have not taken so far. All right, let's move to Dr. Pankaj again. Now we have some short vaccines. Tdap, Dr. Pankaj. TD or Tdap?
Okay.
And any
Uh,
role of standalone TT at all in current time?
yes. Okay. Uh, so, sir, we'll start with adolescents.
We are talking
If
adults today, no adolescents.
Okay, for adults above the age of 19 years, we should give the first dose of TDAP. The first dose should be the TDAP and booster every 10 years of TD or TDAP. But
Correct.
preferably TD is also preferred.
Mm-hmm.
So,
But is there anything wrong if I keep on giving Tdap?
sir, it has been seen that the anti-pertussis antibodies, they wane off after 1 year of giving the vaccine.
Correct.
So there is no rationale in giving the repeated doses of TDAP. Even a TD dose will do the justice. The boosters after the first dose of TDAP, if they have received one dose
But
of
that's
TDAP,
only for tetanus and diphtheria. In fact, you're saying if the pertussis antibody disappear within 2 to 3 years, why not give another Tdap every 10 years if someone is ready to take it? I mean,
the antibodies will last only for 3 to 4 years. In three to
okay,
four years,
fine.
the antibodies decreases significantly.
All right.
So it will
Role
not
of
going to.
Okay, any role of standalone TT, tetanus toxoid in today's time?
So standalone TT does not has much benefit. So I think that it should be discontinued or it should not be used or not be recommended by at least us, at least
Correct. So
pediatricians.
I think the outbreak of diphtheria in Russia when USSR broke into the smaller states was an eye opener. Everyone thought that diphtheria, tetanus are lifelong immunity. It was
Yes,
not
no.
so. There were more than 100,000 cases of diphtheria at that time. Many of them in adults. Of course, those adults whether they were vaccinated or no, we don't know. But they are the ones who had suffered because they were like out of the house, staying on the streets and very crowded area and huge diphtheria outbreak with a very high mortality, 7 to 10%. So that opened the mind that no, and you know, if you look at the current epidemiology of diphtheria in our country, it clearly shows that at least 50 to 60% diphtheria happens after the age of 5 years. That means the immunity doesn't last for life. So I think every opportunity where you need to give tetanus toxoid, you should give TD, that is capital T,
Correct.
small d, so that you also induce a good diphtheria immunity. Because you know, I mean, in today's time, why would anyone develop diphtheria or die of it? So that's about the Tdap, TD, and TT.
And even the
Yes,
cost is
Second,
also very less, sir. Even the cost of TD
yeah,
is similar
TD
to
vac
TD.
and tetanus toxoid cost is almost the same. Tdap, of
Same,
course, is
almost same. Yes.
expensive. Absolutely right. All right,
Even in
Tdap,
Gujarat also, we are getting
yes,
small epidemics every 2 or 3 years, especially in
Hmm.
Gujarat.
every
And
injury.
diphtheria cases coming from them. So
Yes.
they're all vaccinated. So
Yeah, a
70
lot of diphtheria in
are,
Gujarat, I believe. There were some cases also from the south and from Bihar.
Hmm.
So, I mean, interiors of country, the vaccination coverage may not be that great. And the children, we talk about only the primary 3 doses. We don't talk about second booster. Second booster will be a biasmal. And 10 years, Tdap or TT or DT is like almost unknown in the public health. So that's the reason why we are seeing this shift
In
to the right.
fact, Dr. Nitin,
Yes, Kasi.
in Gulbarga Medical College,
Mm-hmm.
23 medicos, first year medical students, they were down with diphtheria during an
My,
outbreak.
my,
23.
my.
And
Oh,
these are the elite educated who are probably know that they have to take vaccines, but probably have not taken it.
which means now the PSM department should not only ensure
Yes.
hepatitis B vaccine during the internship,
Even
but also
TDAP
give
also.
one
TDAP.
Tdap vaccine.
Yes,
Perfectly, I
certainly.
agree with you, sir. All right, Pankaj, what about Tdap during pregnancy? Safety? How frequently? Like you give 1 or 2 doses, and every pregnancy you give it, even if the pregnancy occur like back to back. And does it interfere with the infant vaccine because the infant would be exposed to the recent maternal T, D, and P antibodies? All the 3 questions. The first,
Sir,
safety.
okay. So first I'll start with the schedule, then we'll go to safety
Okay,
or
schedule.
safety. Okay.
All right, schedule.
So the schedule, sir, as per ACIP or FOXY or IIP, it is recommended that every pregnant woman should receive a single dose of TDAP.
Perfect.
Gestation of
Ideally, at
20
what? Which
26
gestation?
weeks of gestation.
You are
And if
sorry, we couldn't hear you very well in between. What did you
sir,
say?
27
Yes.
to 36 weeks of gestational age,
Why
every
this
dose
period?
of TDAP.
Why this
One
period
dose.
alone?
So
Why
the
this
maternal
gestation period?
So the maternal antibody transfer is maximum between the
Correct.
27th week and 30th week.
Correct.
This window is very small. So for practical purposes, this window has been extended to 36 weeks of age. So for
Correct.
practical purposes, the schedule is for 27 to 36 weeks.
And
So this
ideally,
time
at
we give it
least 4
27
weeks
to 30
before
weeks.
the, and at least 4 weeks before the pregnancy.
Yes.
The due
Delivery.
date.
The
Yeah.
But
delivery.
if the mother is unvaccinated or partially vaccinated, in that case, we need to give 2 doses.
Okay. The second could be TD, in which case?
Yes. The second could be TD, and
Correct.
one of them should be TDAP compulsorily.
Okay. All right. Dakasi wants to add something?
I think it is important. We are giving both from pertussis point of view. The second dose is preferably should be TDAP.
TDAP. Okay, yeah, of course, someone can afford TDAP
Yes.
always, but if
Yes.
can't afford, must be at least a TD and not
Or
a TT. No TT
not
in
TT,
anyone's
but
fridge.
if it's a 2-dose schedule, I think preferably TDAP should be the second dose and TD
Correct.
should be for the first dose.
All right, safety, Dr.
Yes.
Pankaj, is it safe?
So this vaccine has found to be extremely safe. Now, there has been many studies. In one of the studies, approximately 630,000 females were given 2 doses of TDAP, more than 1 doses. And so it was found safe, and there was no adverse reactions or adverse outcome in more than 200 females who has received more than 1 doses of TDAP.
So you have the past thinking that TDAP too frequently leads to a lot of side effect is not totally given up now.
Not at all true,
So
sir.
even if a child who has not received any vaccine comes at 10 years, you can still give him 3 TDAP 0, 1, and 6 instead of only TDAP PD TD. Of course, if they can't afford, at least should be TDAP PD TD. So safety is not an issue during pregnancy. All right, interference with the infant vaccine. Very important papers have come up. Yes.
Sir, when the mother receives TDAP, it gives protection, partial immunity or passive immunity to the infant before the vaccinating age, that is 1.5 months. But there has been reported cases that there is interference with the maternal antibodies.
By the maternal antibodies.
With the uptake of the vaccine given at 1.5 years of age, 1.5 months of age. So, with boosters, with completion of the schedule, the antibody titers, they become equivalent to the to the other people.
Correct. So I think all the studies have shown that when you give the TDAP to the mother, the infant post-primary vaccination titers are lower. Seroconversion is the same, but that is only till booster is given, and yet it is still in the protective range. So you are only comparing in mothers who did not receive TDAP versus babies who are born to mother who received TDAP. The titer are lower doesn't mean it's not protected, and once the booster is given, everything disappears. So no,
in one of the studies they say that the cellular pertussis has a better uptake than the wholesale pertussis. In one of the studies they say. Yes.
When I am there and Dr. Kasi there, we don't discuss AP versus WP.
And one more thing,
yes,
Nitin.
sir. Yes.
In spite of the blunting of the immune response, countries which have robust maternal immunization programs have not reported any increased incidence of any of the 3 diseases.
That's because only the titers are a little lower. It doesn't mean the protection is lower. In fact, I give always an example of hip vaccine. We had a hip vaccine which was tagged to PRMP, OMP.
Yes.
And it was only a 2-dose schedule from MSD. All right. It didn't even boost when you gave the 3rd dose. The antibody titers were much lower than the TT or the DT containing hip vaccine. And yet, there was no hip breakthrough disease in children who had taken that vaccine vis-a-vis other. So, we are probably giving too many doses and we are expecting too many antibodies. We are not required that. If you look at the passive prophylaxis for all the diseases where we used to use immunoglobulin, they will still work. Right. So the vaccines are inducing huge number of antibody. We should not worry. You already talked about the every 10-year booster. Is any country actually practicing it or is just on paper?
Sir, actually, I don't think that we are giving it on regular basis, but yes, TD dose every 10 years is recommended. It would be better if we give it.
Yeah. All right. So we stop TDAP there. We move to Dr. Kasi, influenza vaccine. So 3 vaccines that you can give during pregnancy and should be given is TDAP, influenza, and rabies if the mother has exposure. HPV you don't give, you give it at a time of discharge. So let's move to flu.
And now
Why?
RSV
And
also.
RSV metal immunization not available in our country. So we're
Yes.
using the nirsevimab antibody. But yes, surely vaccines will come even against the RSV. All right, Dr. Kasi. First of all, why adults influenza and how efficacious are these vaccines in adults? Both the inactivated vaccine and the live vaccine.
Okay. Now we are in the midst of an influenza outbreak right now.
Yes, right.
And we know the burden that it is causing. 3 to 5 million episodes of influenza every year, 2.5 to 6.5 thousand respiratory related morbidity. 90% of it is in developing countries.
Correct.
The morbidity, mortality, healthcare utilization, etc. of influenza increases exponentially with increasing age and the
Antibiotic
presence
use.
and the presence of comorbid conditions.
Absolutely.
So all these factors definitely point to the need for influenza vaccine, especially in those with comorbid conditions and almost all adults above the age of 60-65 years.
I would even say above 50 because many
50,
between 50
yes.
to 65 in our country have comorbid
Yes.
condition, but
Yes.
they've never tested obesity, smoking, cholesterol, sugar.
Yes.
Suddenly they get HbA1c of 8 and 9 and they were diabetic for more than 6 months. So probably err on the other side and maybe start even at 50 years.
Now we have some data in our country where there was a study done between 2010 and 2013 and looked at the influenza associated respiratory morbidity, mortality and circulatory.
Correct.
And above 65 years, the figures were at least 10 times those that we find below the age of 5 years, indicating that this age group definitely needs the vaccine.
Absolutely. How efficacious are the vaccines?
Now, efficacy depends upon the following factors. Most important is the match or mismatch between the circulating and the vaccine strain.
So
It
fortunately for last 5 years, there has been
We have been a
always
good match. Yes, there has been a match.
Yes.
Now, also depends upon the age when you give it.
Yes.
And
And
the
the
third
endpoints.
and endpoints. And I mean,
Yes.
if you take the endpoint of most of the
Hospitalization.
studies, hospitalization or even laboratory confirmed influenza,
Yeah. Okay.
if you
Fine.
take this as the endpoint,
Yes.
the efficacy is best in the first 3 to 5 years and reduces as age advances.
Correct.
And the presence of comorbid conditions also influence the
Correct.
efficacy of the vaccine. So these are the same thing.
But yet the
Now-
efficacy will be at least 70% in those
Yes,
adults.
yes. Now, where there is a good match, the efficacy can be as high as 77 to 82%.
Correct.
Where the match is just okay, 40 to 50. I mean, there have been periods where there has been a gross mismatch and the protective efficacy has been in negative values also.
Zero.
So,
But
I
yet
mean,
the CDC continue to say don't
Yes,
take the
yes.
vaccine because
Yes.
the good habit should continue.
yes, and we must remember that every dose is also boosting to some extent the T cell immune
Yes,
response, which is going to
absolutely.
reduce the morbidity associated with the disease.
Correct. And we know in children split or subunit doesn't matter, but in adults there are
Yes.
some studies where it matters, especially type B. Your call on split or subunit in adults.
It is almost like DTWP and AP. Now, what is a split virus?
Correct.
You take the virus, you break it with detergents, and you make a vaccine. So the
Correct.
vaccine contains HA, NA, and all the internal proteins,
Many
which
other
elicit a
antigens.
cellular immune response.
Right. Correct.
Subunit is just HA, NA, and you have a vaccine.
More
None
pure.
of them. More
But-
pure, but less of the other components are there.
Correct.
One study which was done sometime in 2011 or 12, where they head-to-head comparison, the split virion gave around 77% efficacy, whereas the subunit was only about 44%.
Correct. Especially
Now-
type B.
Especially type B.
Correct.
Now we must remember that most of the advantage of the split virion vaccine is because of its superior cell-mediated immune response.
Correct.
And these parameters of cell-mediated immune response have positively correlated with viral clearance and
Correct.
decreased morbidity.
And
So
also
in-
the breadth of the immune response rather than a very
Yes.
specific
Yes,
NIH.
immune response. So basically, I think in older adults,
Split
probably
is
the
better.
split is better than the subunit vaccine.
All right. Who should receive influenza vaccine and what is the schedule in adults?
In adults, I think basically those above 50 years or 65 years according to CDC recommendation should receive the vaccine.
Mhm.
18 to 59 or 49 with comorbid conditions which hinders them with for
Perfect.
severe influenza should receive the vaccine.
Correct.
The dose is a single dose to be given
Correct.
annually as
Mm.
close to the influenza season as possible because
As
there's a lot
possible.
of intra-seasonal waning of immunity.
Correct. So
So
the
give it
best
just,
protection is for the first 3, 4 months, 5 months.
yes, so
After
give
that, it
it
starts
as
waning.
close to the onset of the season.
So I say usually when the schools are reopening is the time when the
Yes.
influenza are going to pick up. So the parents also take during that time when they've just
Yes.
come back from their vacation. The child also take.
I
All
think
right.
even April is a little too soon. It should be more towards May, June because
Yeah.
most of the peak occurs in July.
So the schools reopen at least in Bombay
Yes.
in the first week of June or so, or
Yes.
second week of June.
Yes.
All right. 3 more questions before we move. One, high dose flu vaccine for elderly because these
Right.
current vaccines are not, though it's not available, but some
Yes.
one word about that.
Now again, this is because of immunosenescence and a failure to mount an adequate immunological response to the standard dose. So 3 approaches to overcome this.
Correct.
Give higher dose 4
Mhm.
times. Those are the
Mhm.
high dose Fluzone HD.
Correct.
The second thing is add an adjuvant. So
Correct.
you have something called Flu Add, which has MF15 as an adjuvant.
Correct.
And the third is recombinant vaccine,
Correct.
trade name Flu Block. All these 3 increase the efficacy rate by 20 to 25% versus the standard dose. But between the 3, there is not much of difference. All the
And
3
this-
are almost the same.
And this is especially for people above the age of 70 or
65, 65, 70.
Last question on live vaccine. Is available in India
Yes, it
through
is available.
subsidiary of Serum Institute, what is known as
Yes.
MyLab.
Mylan, yes. It's basically what we have is a cold adapted Russian strain of the vaccine,
Correct.
which is again updated periodically.
Correct.
2 years to 49 years is the recommended age, not
Correct.
above 50 years of age, not below
Correct.
2 years of age. It
Correct.
has certain limitations like you should not use it in any child without a wheezing in the past 12 years, immunocompromised, can't
Correct.
use it in pregnancy, etc.
Pregnancy.
But we must remember that UK uses it routinely for all children. And this year in USA, in the recommendations, home administration of intranasal
Live
vaccine has also been recommended.
In fact, in the past, it was supposed to be better than the inactivated vaccine,
Yes.
at least in children. But of course, in between, it had a problem of
Yes.
zero efficacy.
Yes.
But now it has
Yes.
come back with a bang.
Yes. And so basically, I think the advantage of live vaccine is it gives also mucosal immunity apart from systemic immunity, but somehow it has not really lived up so well to its reputation.
Only last one, maybe 1 or 2 sentence, Dr. Kasi. Trivalent versus quadrivalent. Now we have trivalent available from Zydus. Other companies are still going to continue quadrivalent. Does it make any difference except the cost?
I think at least post-COVID, no type B Yamagata strain has ever been isolated from any part of the world. And remember, India also contributes to that global surveillance. So there are no reports even from India.
Correct.
So there's no idea in giving. You cannot have any reservoirs lying dormant which can flare up. So definitely, I think it's time to change out the trivalent.
Yeah.
Now the only thing is,
and if Yamagata comes back maybe a year or 2, we'll switch back to
we can
quadrivalent.
always shift back. The only thing is, unfortunately, that when trivalent changed to quadrivalent, the prices went up by 800 rupees. But now when they are changing from quadri to tri, the cost has come down by 17 rupees only.
Correct.
That's
We don't discuss cost, we discuss science. Move to Raju Bhai. JE vaccine, typically a pediatric vaccine. What is the role of JE vaccine in adults? Because there are some districts where it's part of even the national program. And why?
The Japanese encephalitis is a disease which doesn't just look at the age, though higher epidemic in the pediatric age group, but it affects adults also.
Correct.
And those who are staying in the endemic areas, they are likely to suffer from this disease, which is a very deadly disease. So I think certain population which is staying in the endemic area, especially in the rural area, they should receive this. Those who are going to that area and going to stay for more than a month or so, travelers, they should also
travelers vaccine. Yes, because the adults from non-endemic area have no immunity against JE. So they will be really badly affected if they get JE there. So they should take. So at least there are 27, 28 districts or maybe even more now where a shift to the right has already happened with successful pediatric vaccination, especially in Assam and Northeast where adults also are routinely given the JE vaccine. How many doses, Dr. Raju? Same 2 doses
Again,
or
2 doses. Yes,
Single
same
two
two.
doses? Yeah. All right. The schedule is the same. 1 month apart.
Yeah, right. 2 doses, 1
Right.
month apart.
Okay. Any data on its safety and efficacy in adults? Like we have a lot of data in children.
Yeah, there are some studies which have shown that the vaccines are almost safe in adults also,
Correct.
and there are no very severe side effects in adults also.
Perfect. Perfect.
The
This is one of the
study,
safest vaccines.
the study from Assam has shown 70%, 77% efficacy in adults.
That is the same as in children with 2
Yes.
doses.
So
Yes.
same as, and from their post-licensure, studies, they have shown that even the safety is also equivalent.
Absolutely.
to children.
Absolutely. So, when we started using the SA1442 live vaccine from China, the study in Sarai region of Nepal and in Korea had shown 1 dose was enough, leading 98% efficacy, but it didn't happen the same way in India, where the
Yeah.
efficacy was around 50-55%. When they made it 2 doses, it became almost
Went down.
85 to 90%. So we must use 2 doses, whether it's pediatric or adult. All right, let's come to some rapid fire type of vaccines now, because we have another half an hour. So, Dr. Pankaj, immune compromised host. Which are the vaccines? We are not discussing why. Which vaccine an immune compromised host is given?
Sir, for immune compromised host, we can offer them hepatitis B vaccine if they have not previously vaccinated. Influenza vaccine, annual influenza vaccine is necessary.
Perfect.
Then pneumococcal conjugate vaccine, PCV.
Okay.
They should receive PCV. Then they should also receive hepatitis A vaccine inactivated if they are prone for certain infections.
Mhm.
Typhoid conjugate vaccine,
Mhm.
varicella vaccine.
Mhm.
These are the vaccines which we should be recommending them.
If not varicella, Zoster vaccine, because many of
Zoster
them
vaccine, yes.
had varicella as a child. All right. So what about the context of the immunocompromised host? Because
Sir,
they can bring the disease
yes.
and infect the immunocompromised host in the house. So what do you do about the contact, like the family members?
So contacts of these patients immunocompromised hosts, they can be offered vaccines like influenza, MMR, varicella vaccines. Then Tdap should be given to them. COVID-19 not received at that time. PCV20, a single dose of PCV20 would suffice. So
So
these
any
patients should
precaution
be.
you take when you give the live vaccine to the contact?
It should not be given transmissible live vaccines like OPV. They should be given or
Correct.
substituted with OPV if required.
Perfect. So no OPV in an area where adult with an immune or even a child immune compromise is there.
Yes.
Rota, if it's given to the baby, strict hand hygiene and barrier nursing,
It should be
then it's
maintained.
okay.
Yes, definitely,
If the
sir.
child, if they are given MMR, varicella, if they do have rash, they should be again separated because there are some small risk of transmission
Yeah.
when there's a rash, especially with the varicella or the measles vaccine. All right. Let's move. Anything else you want to add, Dr. Kasi, to the immune?
No.
Like, it's a big topic, we can't
Yes.
discuss. But I will just say from I practice a lot of oncology. So all our patients who are chemotherapy, like all the chemotherapy today are very, very heavy, severe, because that's the reason why cure rates have gone up. We start vaccinating them 6 months after the last chemotherapy was given. When you say last chemo means including the maintenance therapy. That's the time when the immune rebound has happened and you give them all the remaining vaccines. And if they've taken previously, either you can do an antibody to check if they're still positive, you need not give it, otherwise give 1 more dose of
One
the
booster.
vaccine. All
think
transplant patients, you give killed vaccine after 1 year and live vaccine after 2 years since the transplant and patient being off any severe immunosuppression for
Transplant
GVHD.
patient, sir, I have read somewhere that transplant patient live vaccines, they are contraindicated or
No. So you
they should
don't give
not
it
be
for the.
given.
So you start
Okay.
killed vaccine after 1 year because the immune reconstitution happens only after that time,
Okay.
and they should be off any immunosuppressant.
Even
And
in
live
solid
vaccine
organ
still
transplant, sir?
only after 2 years, not even 1 year, 2 years.
No, I
All right.
think
Yeah,
what
doctor.
Dr. Pankaj, I think
Ah,
live vaccines are generally conjugated after solid organ transplants.
Solid
yes,
organ
yes,
But
transplant.
yes.
Yes,
but
yes.
now they have seeing a lot of studies have shown when you use it judiciously, when immunosuppression is minimum, you can give live vaccines even following solid organ transplant as well.
You know what is the reason behind this difference between the two? That solid organ transplant patients are generally never off any immunosuppressant.
Yes.
Whereas the stem cell transplant as bone marrow
They
transplant
go
patient,
off.
because you are finishing off the patient's bone marrow and the recipient bone marrow taking over, there is no need to give immunosuppression unless there is
Right.
a very serious GVHD. So that's the whole difference between the two. All right, let's move to RSV vaccine. Dr. Kasi,
Right.
you mentioned that fourth vaccine that you can give during pregnancy is an
Yes.
RSV maternal immunization. So are they, of course, no vaccine available in India. We are discussing that they are likely to come in the future. So what vaccines are available for adults in general?
3 vaccines are available internationally. One is by GSK. All of them have
Correct.
funny names. One is by GSK, which is called RXVY. Then
Correct.
there's one by Pfizer, which is called Arbiswo. And the third
Yes.
is a mRNA vaccine called Mresvia. There are 3.
Correct. Correct.
Now, of these, the GSK vaccine is adjuvant with ASO1E,
Same.
the same which
Yes.
was there in the
Correct.
Shingrix vaccine.
Correct.
The Pfizer vaccine is not adjuvanted, and mRNA
Correct.
vaccine is also not adjuvanted.
Correct.
If you look at the phase 3 studies, the GSK vaccines has given sort of maximum efficacy rates, and
Mhm.
it has shown significant protection till about 3 years of follow-up also in the phase 3 studies. The
Correct.
Pfizer vaccine has shown significant reduction, so that by the end of 2 years, there's a very significant fall in the protective efficacy.
Correct.
Mresvia, I am not aware of any
Yes.
follow-up beyond 7.5 months.
Correct. A
Okay.
lot of talk against
Now,
mRNA vaccine generally is happening,
and
even in USA.
the other thing is, one black box warning with the product insert is a little increased incidence of Guillain-Barré syndrome with both the GSK and the Pfizer vaccine, about
Perfect.
7 to 9 additional cases per 100,000 vaccinees.
Yeah.
So this is one thing.
Instead of 1 per 100,000, which
It
is
is about
usually
7
norm,
to 9.
7, 4,
7
5.
to 9. So these are the, in short, brief about the
All right.
available RSV vaccines.
Only one vaccine is licensed in for pregnant ladies, and that's
Yes.
Pfizer. So some light about RSV vaccine during. We are not talking about nirsevimab or the pelimumab antibody which we give to the baby. We are talking about vaccine. Please, audience, remember. So which RSV vaccine during pregnancy and how good it is?
Only the Pfizer vaccine, Arbiswo, is licensed for use in pregnancy.
What happened to GSK's vaccine?
GSK
Why
vaccine, there was an increase in instances of preterm births in the
prematurity?
phase 2 studies
Right.
itself, and they
Correct. So
abandoned
they
it.
gave it up. Right.
They gave it up.
And who should take when it comes to, and what should you?
It should be administered in a single dose between 30 to 36 weeks. And unlike Tdap, which is repeated in every pregnancy, here you give it only in one pregnancy. You don't repeat it in every
Correct.
pregnancy.
And adults, means not pregnant, but adults, what age group?
Adults usually, the
After
CDC
60.
says above 75 years.
Yes.
And high risk between 50 to 69. The
Correct.
product insert says above 60 years
65. Correct.
with 18 to 49 as the high risk group for these vaccines.
Correct. So the licensing is different than the
From what
recommendation.
the CDC has recommended.
All right.
Now,
Let's move to the, yeah, sorry, go ahead.
Now, the other thing is maternal vaccination has been extensively used in many countries, and we have data from Argentina where at the end of 2 years, I mean, the protective efficacy is close to about 77% against medically attended RSV. And if you compare that to nirsevimab, we must remember that maternal immunization exerts its maximum efficacy till about 3 months, though it is
Yeah, 120
licensed for
days.
prevention till 90 days, till 6 months.
Right.
Nirsevimab is licensed till 6 months, but it shows high antibody titers almost till 1 year, and there is a possibility that it may exert protection till 1 year.
Absolutely.
Antibody
There is actually data. There is
yes,
data to
yes,
suggest that.
yes. Now, antibody titers are much higher with nirsevimab and persist for a little longer time. And the third issue is what is known as a number needed to vaccinate to prevent. Now, this NNV is about 25, depending upon the study and situation, 25 to 55, 70 for nirsevimab, but it's over 85 to 120 for the maternal immunization.
Correct. That's why lesser and lesser countries are actually resorting to maternal
Yes.
immunization, and more
And
and more
going more
countries
for
are
nirsevimab.
nirsevimab.
Yes.
All right. All right, let's move the gear. Dr. Rajubhai, adult TB vaccination. What is the recombinant BCG and what is the data so far? How promising?
Yeah, recombinant BCG, shortly known as RBCG,
Correct.
it is a genetically modified our own old BCG vaccine. Because of this, it gives a broader immune response against
Correct.
DG. Right?
Correct.
And in phase 2 trials, it is considered to be a better. There is a good immune response central and effector memory T cell subsets are increased. There is an inhibitory T cell specific response is also there. And so BCG 30 is the first TB vaccine which can be used in adults. Now there are so many other candidates of similar
No,
vaccine.
so let's first discuss, let's finish RBCG 3 trials are going on. Neonate to replace standard BCG in South Africa. Data is still not out. 2 studies in adult, one in those who had past TB to prevent reactivation, and number 2, giving it to the context of patient of TB to prevent transmission. None of the study data is still available. So I think it's a promising vaccine. We don't know. It failed as a COVID vaccine.
Because of that it has been delayed.
Correct.
So that,
All right. What about the M72 TB vaccine from the GSK? It has some efficacy phase 3 data.
Yeah, again, there is a phase 3 trial going on. There are, in March 24, probably they have recruited around 20,000 candidates for that, participants. They are in almost more than 50 different sites in different countries. And we are still waiting for the response
So the public data showed around 55% efficacy in adults in preventing a reactivation. I think this is fair. It's not still crossing the WHO definition of 75%, but still then nothing was available. That was a good vaccine. And now you have an MTB vac, Bharat Biotech, which is bringing it up. Any idea about that?
It is again a genetically modified vaccine. I think prepared in one of the laboratory in the Spain. And again, it is advancing through clinical trials.
Yes.
The vaccine has been prepared after almost 25 years of research. And again, the same phase 3 trial is going on. We don't have the data on that.
So I am part of the DMSA member board. I can't reveal too much, but the phase 2 is almost over. And once we give an approval in the next month, the phase 3 will start. So it's an exciting vaccine because again, it's not a live vaccine. It's a recombinant vaccine.
Fusion protein.
So you could give it even to immunocompromised and things.
It's a fusion protein.
It's a fusion protein. All right, Dr. Pankaj, coming back to your favorite topic, HPV vaccine. We know a lot about HPV vaccine, but I think we will discuss just few which are important from adult point of view. Till what age are these HPV vaccine licensed in India and abroad, and why the difference?
Okay. So
let's talk about, say, first Gardasil. We'll take brand name, Gardasil 4. Okay. Indication
Gardasil
India,
4.
indication outside.
Yes. Sir, Gardasil 4, it is a quadrivalent vaccine. It is available both in India and abroad. And the recommendation is for 9 years to 45 years of age, both in India and abroad. So this
but not for males in India.
It is a female-only vaccine. It is only
in India. Abroad, it is also male and female both. It's gender-neutral vaccine.
Yeah. Okay. Abroad, it is gender-neutral.
Yes,
okay.
It is gender-neutral vaccine.
So in India, it is female-only vaccine.
Okay. Now, Sarvavac.
Sarvavac, it is available only in India, and it is gender-neutral vaccine from 9 years to 26 years of age.
Perfect. And Gardasil 9.
Gardasil 9 in India, the schedule is different from that available internationally. So Gardasil 9, when we give it to the females, in India, it is 9 to 26 years. While abroad, it can be given up to 45 years of age till to all the females. And in India, it being given to the boys, it has to be given for 9 to 14 years. And abroad, it can be given up to 26 years of age to even males.
Correct.
The Gardasil 9.
Okay, the difference in the schedules.
So, sir, for any vaccine to be licensed in India, the DGCI, the approval has to be taken from the DGCI. So, it depends on the data and the study which is submitted to the DGCI and showing the non-inferiority of any vaccine.
So, DCGI, Drug Control General of India, yeah, DCGI.
Yes.
Yeah.
So in India, the data which has been provided, it has provided only till the age of 14 years.
No, let's first talk again Gardasil 4. Gardasil 4, what is the schedule in children and adults in India? You said male, female,
9 to 45. 9 to 45.
Yeah, but schedule
9 to 14, 9 to 14, 2 doses, 14, 3 doses.
Sarvavac?
Yes, 0 and 6. Sarvavac, again same 2 doses before 14 years, 3 doses 14 years.
Correct. And Gardasil
9 also same.
Gardasil 9 licensing is only for 3 doses, even at 9 to 14 years. So the ACVP under Dr. Kasi took the bold step. that no, you can give 2 doses because internationally is recommended only as 2 doses. So these are
So-
the subtle differences you should be aware. If the parents insist, then give the third dose. I mean, there is no, you have not to lose anything. Remember, UK gives only 1 dose from 9 to 20 years. So we are actually already giving too many doses. So giving 3 to 9 to 14 years
Makes
is
no
too
sense.
many, and so much of money is lost. But yes, if the parents insist on what is licensed, then that is a licensure as far as Gardasil 9 is
Sir,
concerned.
in
So,
immunocompromised,
some
we give 3 doses.
yeah, immunocompromised should receive complete dose. Yeah, Raju bhai, sorry.
in some of my patients, when they are talking about the cost and not getting ready, I tell them take at least 1 dose. Then
Perfect.
we'll discuss about the second dose. So if they get
Perfect.
1 dose, at least they are protected that way.
Perfect. And I think about the reduced dosage as a public health policy to reduce the cost and make it available more easily, the WHO has said that 2 doses are enough. 2 doses, 1 dose is enough for 9 to 20 years, though 2 are licensed. I mean, 2 are recommended. And 2 doses are enough in adults above the age of 20, though 3 are recommended. So the world is moving to lesser and lesser HPV doses. So as Raju bhai said, if someone can't afford all 3, give at least 1 dose of HPV 9, which will at least boost up for the remaining serotype, then just continue with HPV 4. Dr. Kasi, any last word on this?
I think whatever studies have been done regarding 1 dose is only with cervical cancer as the
Females.
endpoint.
Yes,
We do
yes.
not know whether 1 dose will work for anal cancer, penile, vaginal, oropharyngeal. We don't know.
Correct. And
So,
males, there's no study
and
in
males.
males.
There are no studies in
Yes.
males.
Correct. But we presume that in males, the surrogate
Yes.
efficacy is always derived from female
Yes.
efficacy.
Yes.
The female
Yes.
is work so well, probably the male also should work
Yes.
well. All right.
Yeah.
Let's move to Dr. Kasi. Rabies vaccine. Any higher ceiling, like 120 kilo adult come to me with 5 multiple wounds. How much is the maximum dose of either say
Right.
rabies shield or the twin rab I can give?
See, there was a time when a ceiling was given.
Mhm.
For the ERIG, it was about 3000 units. For
Correct.
HRIG, 1500.
Correct.
As far as the monoclonal antibodies, there is absolutely no ceiling, but unfortunately, the company has said that 70 kgs weight is what they take as the maximum dose.
Correct.
But
Correct.
now, since I think 2024,
They've
that
changed.
yes, the limit has changed, and now you calculate according to the body weight, and that is the maximum dose. So
Correct.
there is
So
no
I think
maximum dose.
correct. So I think we reiterate that the maximum dose. So when 120 kilo adult come with a small single wound, you need
Yes.
not give the entire
No.
whatever comes to around 500 units. You may give only 50 units and save
Yes.
the money. At the same time, a small child come with 10 wounds and the dose comes to 50 units. Dilute
dilute it.
2 times, 3 times, 5 times, 10 times. See that you cover every wound.
Right.
So there is no ceiling to the monoclonal antibody dose for rabies
Right.
is concerned.
Right.
Okay, conjugate typhoid vaccine, Dr. Raju bhai. Till what age? It was there in the Gujarat WhatsApp group also. Can a 75-year-old man can take vaccine? Can a 65-year-old can take? So what the age limit for the Bharat Biotech's typhoid conjugate vaccine? Because that's the one which is
So,
the recent recommendation.
the age limit is 45, but there was one study which was a phase 4 trial for extension and specific population, where they had, in their study, they had 300 adults. Out of that, 200 adults were above the age of 45, between 45 and 65, and the results were excellent. So it can be given up to age of 65.
Very recently, they've done another phase 4
85.
study of up to 85 years of
85.
age. And they've shown the antibody titers between 60 to 85 are the same as between 18 to 60 years. So, of course, the product insert still says 65, but very soon, probably it might have already changed. I'm not aware. But you can actually use it till 85 years of age. All right, Dr. Pankaj, meningococcal conjugate vaccine. Adults should take it. So, for whom and how many doses?
Sir, this vaccine is important for patients having asplenia or for patients going for splenectomy. 2 doses are required for such patients. It has to be completed at least 14 days before the splenectomy or at least after 14 days after the splenectomy. The emergency
Preferably is before spleen. Because spleen is a major organ to
Yeah.
produce antibodies. Yes.
In HIV infected patients or patients with HIV, 2 doses are required for such patients.
So all
Then-
immunocompromised 2 doses, right?
Yes, yes.
Yes.
Laboratory personals or healthcare workers who are in close contact, a single dose may suffice for these
Correct.
patients.
And
then
the
international
university
travelers,
students.
So for
University
international
students. Yeah.
university students, yes.
Yeah.
Then international travelers who are going to Hajj pilgrims,
Yes.
vaccination in the 3 years, the certificate is needed from the date of travel. So
Correct.
we preferably give quadrivalent vaccine to these patients. Then people traveling to the African meningitis belt, a single dose of quadrivalent vaccine is recommended for these patients.
But that's actually not mandatory from visa point of view or quarantine point of view, but it's good to take it because you're
Yes.
entering a
Good to
very
take
high
it,
risk
yes.
zone, right? What
Yes.
about people with terminal complement deficiency and other primary
Yes.
immunodeficiency?
These
Adults also
patients
should,
require
yeah.
2 doses of vaccine.
Yeah,
These
because we have
patients can
had
be given 2
patients with
doses.
protein C deficiency and protein S deficiency coming with recurrent pneumococcal sepsis, meningococcal sepsis, and they go into what you call the purpura fulminans type. So if they've taken the vaccine, though they may not respond as well, but it is good to give them the vaccine. All right. There is
Sir,
one very exciting. Go ahead. Yeah, sorry,
so
Pankaj. Yeah.
any word regarding the pentavalent vaccine from
Yes.
Serum Institute, the
So it
18
is licensed
years
for
and above.
above age of 18 years in India. It has the, I think, the X as the
X
additional to
X.
the
antigen.
ACYW. Yeah. And X is becoming the remaining disease burden in African belt after the ACYW has taken backseat. Initially, it was only A, they had Men Africa A, which wiped off A. Then the remaining CYW started coming up. They switched to ACYW quadrivalent. Now X is coming up in some areas. So now they've introduced ACYWX in Africa. It's also licensed in India for use. In fact, it's a highly immunogenic that even 1 dose is enough.
Oh, yeah.
So but it's not for below 18 years. The studies are going. I've been fighting with the Serum Institute that if you do study in children, then and as we know, Serum tries to bring vaccines at cost which are very effective.
Reasonable
We may
cost.
actually use more liberally meningococcal vaccine in children, which we are not doing today. One, because the disease burden is not there. Second, the cost is very high, and the third is longevity of immunity is not that great with the current meningococcal conjugate vaccine. Okay,
Repeated.
we'll switch to the last 2 part. Dr. Kasi,
Yeah.
rapid fire. For the traveler to countries like say Kenya, so I'm going to for African safari. OPV, IPV, which one?
Generally, what is given is OPV in most of the
Right.
travel centers.
Right. Yellow
IPV
fever?
also. Yellow fever, yes. Yellow fever
Yes.
has to be given in a single dose at least 10 days before travel, and the
Correct.
validity is lifelong.
Lifelong. Can I
Yes.
give yellow fever from I have a Sanofi's
No.
vaccine I brought? No.
No,
Why
yellow
I can't
fever,
give?
yellow fever vaccine can be given only at government
No,
authorized
why? What is the
centers.
reason?
Reason is because that has to be endorsed on a yellow card of the WHO, and
WHO.
unless you're
Right.
a government medical officer, you don't have the authority to sign on those
Or you
cards.
have to register with the WHO as a licensed center, which some
Yes.
centers are there in Delhi, and then only you
Yes.
can. But then there are strict criteria, how much you can
Yes.
charge, how to
Yes.
store, pre-counseling, post-counseling. I mean, I have taken yellow fever, but I went to Kenya just 2 years back. It's a beautiful system.
Yes.
They take you by turn. 10 minutes they will discuss with you. Those with egg allergy, raise a hand. Those who have missed the period, raise the hand. Go out. You can't take the vaccine. Then remaining, they make you wait for half an hour, like how they used to do in COVID time. Very, very beautiful system. So I think we should not venture into. I've seen many pediatricians giving it in the past when the Sanofi vaccine available, and they would give certificate on their letterhead. That's not
No
valid.
use. No use.
That patient, when he comes back, he will be quarantined for 10 days
Yeah,
at
definitely.
the airport itself. All right. So that was the OPV, IP, yellow fever. Who can give certificate? We've discussed. Okay, people with egg allergy, can this vaccine be given? Yellow fever.
Well, there's a lot of rethinking about the safety of yellow fever vaccine in those with egg. We must remember that especially the Sanofi vaccine has a very significant amount of ovalbumin, which is one of the. So anaphylaxis can occur in those who have anaphylaxis to egg allergy.
Correct.
However, currently, even egg allergy is not a contraindication but a precaution. There are definite protocols set into place for giving the yellow vaccine to those who have anaphylaxis to egg proteins, where you do a skin prick test and the intradermal with undiluted vaccine. And if the skin prick test is positive but the intradermal is negative, you give 2 doses, 0.25, 0.25 at 30 minutes intervals.
Yeah.
If both are positive, then you give graded doses of a dilute vaccine. You finish the entire procedure within about 2 hours.
The only thing is this is actually not done in any of the government centers. So that's the problem. Those who
Yes.
have egg allergy, they just have to be
Say no.
quarantined when they come back. They can
Yes.
travel, but they have to be quarantined. Same for the pregnant ladies, same for the immune compromised
Yes.
host.
Yes.
Okay, how many weeks before you said 2 weeks is effective lifelong OPV covered? Okay, Dr. Rajeshwar, last few questions. Adults, can they take hepatitis B vaccine if they've not
Yes,
taken in the past?
if they have not taken in the past, or if they are
Yes.
tested, and if they are their values are titers are low or not detected, then they can take the
Okay, and especially if they have a contact with a HBsAg positive
Yeah.
person in the family, because we know in a cluster of family where one is HBsAg positive, the chance of other
Lovely.
family members being positive goes as high as 20 to 25%. And that's because of the horizontal transmission to the routes which are unknown or we don't realize, like kissing, hugging, using like some small abrasion here and there and things like that. What about hepatitis A, Dr. Rajesh, about adults?
Hepatitis A also can be given, especially inactivated hepatitis A.
So would you do an antibody titer and then give or just give the vaccine?
Yeah, endemic country you may do it, but there is no need to do because it's not
No
going
need to do. Okay, live vaccine is licensed till what age in our country?
Live vaccine is
No upper
I
age.
think
Till 45 years of age.
it's a limit. It is 45 years of age.
Yes, so we can use live vaccine single dose even in adults, right?
Yeah, up to 45 years.
Okay. Can an MMR vaccine be taken by an adult who has not taken in the past?
Yeah, sure. MMR also
So
can
there's
be
no
given.
upper age for MMR.
No upper age for that. Even
and
those who are going to the university
yes,
study USA, they ask for them. Even those who are going for visa, they give their vaccine.
correct.
Nitin,
Yes,
Tresivac is licensed only till 10 years of age.
that's correct.
Priorix does not have any upper age limit.
Correct.
So legally, you are more correct if
Correct.
you use Priorix for adults rather than the
Correct.
Tresivac.
All right, but that's more of a licensing rather
Yes.
than a scientific reasons.
Yes,
for it.
exactly.
Yeah. And in fact, in the USA, where there are outbreaks of mumps in an area, they give the third dose of MMR to adolescents and young adults because they are the ones
Yes.
who get affected. So MMR, there's no upper age.
In US, one caveat that you should give MMR to those who are born after 1957. Not early.
But the booster effect of the measles or the mumps component, it comes down immediately after giving the MMR as a booster in adolescents or adults. It does not last long.
Persist.
So in adolescent
long.
adult, it's a outbreak response vaccine. Let's say this way. So the
Okay,
short
just
in
for
a
the
short
outbreak
term, it
response.
will prevent outbreak to spread and will protect the ones who are otherwise likely. Mumps at that age can be bad. It leads to orchitis or
Right.
ophoritis, can lead to primary sterility and so on and so forth. So I think I've discussed most of what I wanted to discuss, and we have another 5 to 7 minutes. So Pallavi madam, can you please allow everyone to unmute, and if someone wants to ask a question, please ask.
Yes, sir. Yes, sir.
Yes, please.
Doing the same.
Yes. Anyone has any question? We have excellent panelists with us. Make use of their presence. Yes. Someone is asking Subhash Rao. Should English be given after attack of herpes zoster? Yeah. Very important question.
Yeah.
Yes. Why?
Yes,
The incidence.
Yeah. Go ahead. Anyone? Raju bhai. Okay.
Incidence is fairly high in those who have suffered from the disease, and because it is after your immunity goes down, their immunosuppressant, and then the virus comes out and you get the disease. So
the second attack of zoster is seen in 15 to 20% of those who had first attack, and especially in immunocompromised, it can be as high as 50%.
And the second episodes are usually more severe than the first episode.
Right. Is there any other question in the chat box, or anyone wants to ask any question?
Yeah, but the question is,
Sagar,
what should be the interval after? What should be the interval after herpes zoster that the vaccine can be taken?
After zoster recovery, when can you give? As early as a month?
After clinical recovery, you can give
After
it.
clinical recovery. All right. Anyone else?
Because in one paper I was reading that if it is an immunocompetent person, we can even wait for 3 years, and if the person is immunocompromised, you should give after 3 months. So.
Correct.
Yeah, after the clinical recovery, you can give. There is no such.
Okay, there is a question on lawsuits. What about lawsuits against HPV vaccine in the US? There are absolutely no lawsuits which have sustained. There is a clock going on of how many people have died of HPV. It's all anti-vaccine lobby, and there is absolutely no iota of doubt about the safety of the vaccine. Not a single country has withdrawn this vaccine except for some time where some deaths were happened and they were investigating. Like I remember a few years back before COVID, British UK was giving school-based vaccination program, and one girl died after that, and the entire program was suspended. And then they found on the postmortem that the girl actually had lymphoma.
Yeah,
she died of suffocation because of lymphoma and not given vaccine. The program started again. All right. Why is Shingrix so painful? Rajesh Kulkarni, we already said that it's because the adjuvant, which makes it that painful. Any recommendation of COVID vaccine? What is COVID? So US still keeps on giving COVID. In fact, very recently AAPA recommended to start COVID vaccination to as small as 6 months of age onwards.
Yeah.
I think they are overdoing it. I mean, we have had COVID in Hinduja, and I'm sure it must be same in other hospitals. Don't isolate them. They don't die now. They are all elderly who would have otherwise developed some influenza, some pneumococcal. Now COVID is another virus we list to, and it's not that scare that was there, say in 1999 to 2002.
Even in my hospital, I had a child 4-year-old and had a COVID, but
Correct.
nothing needs to be done. It's just like
Correct.
a other case of influenza or a like that.
Correct. So we have stopped seeing
Sir,
COVID and we have stopped seeing Covisaki. That is COVID-associated Kawasaki-like
Kawasaki.
syndrome. Yes, Krunal.
yes, sir. Sir, one more question. If we have given pre-exposure prophylaxis of rabies, and they are bitten by a dog category 3 bite within 3
Correct.
months, should we
Yes.
give a monoclonal antibody?
No,
No.
within 3 months, neither.
No.
After 3 months, only vaccine. If they're immunocompromised, then vaccine as well as monoclonal antibody.
Okay, sir. Thank you.
All right.
Sir, one question. Any
Yes,
problem
please.
of giving PCV and influenza vaccine after the next day of tooth extraction?
Yeah.
I think
Yes,
women
exactly.
are free of you. I mean, why did they wait till tooth extraction?
Appointment is very difficult to get for the dentist and already other vaccines.
my.
See,
Oh, yeah,
both
sure.
both are inactivated vaccines, so the interval doesn't matter. You can give it anytime.
So I after that question is asked by Dr. Letha, I really sincerely wish that I was either a geriatrics physician or an adult physician or a cardiologist or now a dentist. Because I have no problem of giving appointments to my patient, whereas these people have a lot of patients that they have to wait. All right, I think we will conclude over
Thank you,
to
sir.
Dr. Pakmode or to Dr. Minaz, whoever is going to conclude.
Yes,
Or
sir.
Amol.
Yeah, Pakmode, sir.
Yes, wonderful discussion and a lot of queries, a lot of answers. A lot of confusion has been taken care of, because adult vaccination is a very different scenario. What we know up to the 5 years, everything we know, but later on it is very difficult. If the patient asks a query immediately in the office and you have failed to answer that query or failed to answer that, then it becomes something a very situation like you as if because they are the Google servers and they search anything and then they can ask the question. So you must get updated yourself. And I think that the panel has updated so much like this. So it definitely going to help every attendees today in future for adult vaccination. And this is, I think,
Done.
this is a neglected topic, but everybody must emphasize on this particular adolescent vaccination, so that can become a source of income also for the pediatricians if they emphasize on their patient. Because once the patient begins with after birth, he had a more faith on you rather than the adult physician.
Correct.
So that's the thing. I think it's a great insight for us, sir. All of us. Thank you, sir. Thank you,
So
Radisha,
before
sir.
Dr. Pakmode, we end. If there are any question, because in chat box I saw more than 190 chats. Most of them are for putting their registration number.
Yeah.
Any question that arises even afterwards, all of you have my number, my email ID, Dr. Kasi and Dr. Radisha's number and email ID. Anyone wants it, you can get from the MyIP and we will help you out. You can ask any question anytime and we are very happy to help you out.
Done.
Thank you very much, Dr.
Thank you.
Radisha, Dr.
Thank you, sir.
Kasi,
Thank
Dr.
you.
Pankaj for sparing your valuable night and time with us and discussing threadbare the concept behind adult vaccination rather than individual vaccines. And I really again thank Dr. Pakmode, Dr. Amol and all the office bearers of MyIP for starting the very innovative Vaccine Samvad this year and having faith in us, me and us consistently month after month. Thank you.
Thank you, sir.
sir.
Thank you, sir.
We'll meet
Thank you, sir.
again on
We are
the
lucky
next
enough to
month,
have people like you on our platform.
September,
I am
Kasi sir,
honored to
Raju
share
Shah
the
sir.
desk with
Yes,
Kasi
and
sir
Pankaj.
everyone.
Definitely.
Thank you, sir. Thank
Yes,
you,
yes.
sir.
Thank you, everyone. Good
Thank
night.
you.
Great job. Good night, sir. Good
Good
night.
night,
Good night,
sir. Good night.
Good
Thank
night.
you.
Good night. Good
Night,
night.
sir.
Good night, Minhas, sir. Good night.
Good night, sir.